Yeah, but who in the organization is best positioned to address the issue? Is it HR, the manager, occupational health? Part of the difficulty is getting to the right person. Anybody want to comment on that?
I'll try that one first. I say that we can have all of the professionals and experts in the workplace that we want, whether it's human resources or occupational health, vocational rehab, disability management. But where the rubber hits the road is the day-to-day interaction between the supervisor and the employee. So although everyone needs to understand this and everyone has a role to play, it is the supervisor. You know, I always say we blame the mother, right? It's always the mother's fault when the kids go wrong. It's not true, but the reality is the mother has more control and influence than anybody else, and therefore has a higher duty of care towards the child. In the workplace, the supervisor or the manager has more control and influence over the culture in that department, how people interact, how work is given out. Therefore, the supervisor has a higher duty of care to be able to recognize when somebody is struggling, to be able to approach them and be able to link them to the right resources. I get supervisors who get a letter saying, this person's returning to work and they have to have less stress. Well, what the heck does that mean? So you know what the supervisor does? I'm not going to look at them because, like, I could push them over the edge. I could say the wrong thing, so I'm not going to do anything. Well, that's not fair. That's not fair to a supervisor who's now walking on eggshells. And we have to provide them with supports and tools to be able to do this.
Yeah, that's interesting because one of the other comments was, and I think from a manager's point of view, we're often asked here, how do you approach that discussion? If it is our role to engage with our employee, how do we approach it? What do we...
You don't say, Donna, you're looking mentally ill today.
Right.
That would be bad.
Yeah.
It's what Donna said. It's that idea of, I haven't got a clue. I had somebody that worked for me once and she had panic disorder. And I had never seen it. I knew she had it, but I had never seen it. So the one day, she calls me into her office and she's having a panic attack. And I'm going, oh, it's going to be all right. You're going to be fine. And I'm there with her. And I stayed with her for what, to me, felt like 5 hours. It was only 5 minutes. It was a very short time. And she said, I'm okay now. And I went back to my office and I sat down. And she came in a short while later and she said, Marianne, and I'm thinking, because this is before I was ever in this field, right? She said, you know how you came in and you were there with me while I was having my panic attack? And yeah, I'm there for you. She says, well, you didn't help at all. She said, you were panicking more than I was. I said, well, what do you want from me? And she said, all I want is to know that you're going to stay in the building and I'll leave me alone and I'll be fine. So I can do that. I'm really good at that. A little while later, I met this guy. We were sitting in committee meetings together, so we would sit side by side, and he said to me, you know, I have panic attacks. And I said, do you want me to leave? And he goes, no. He said, what I want you to do is if I tell you I'm having an attack, I want you to hold my wrist. He said, it can't be on my shirt. I need your hand to touch my skin. And I said, okay, and he said, just hold it under the table. He said, I'll still have the panic attack, but it grounds me and I can pay attention. So we were both married to other people and I'm holding his hand under the table, but what the heck, right? So the point is, I don't have a clue what anybody needs, and neither do you. So we ask, what can I do to help? How can I help you? And Donna said about helping her be a better person, but I can't do that. I haven't got that power, I don't have that control, but I can help her to be successful in her job at work. That's all I can do, because I can't do the rest. She has to be a good person all on her own, but I can help her at work. Yeah.
You know, a related comment, and I think this is maybe for you, Donna, is if you're not fortunate enough to have a manager like you, who can show concern and care and knows what to say, do you have any tips for employees on how to communicate more effectively? Any suggestions there?
One of the wonderful roles that I have now is that I receive a lot of communication from employees who are struggling, and a lot of people ask me that question. Generally what I respond back with is manage up. What your manager isn't doing for you, you do and model it for them. So and a lot of people go, well, that's their job to do that. And yeah, okay, except how's that working for you? It's not working. So it means you do the work for your manager within the discussion with your manager. So that means you describe for your manager what you might need, and you use language of needs. You can engage the manager to be able to understand that if they do certain things in a certain way, problems will be alleviated, things might go better. So it's about taking a leadership role if your manager isn't doing that. And it can be very challenging, and it's not at all easy to do, particularly when you are struggling. So this might be something for you to discuss with your own therapist, with your own supports around you. Some people actually in the Working Through It resource talk about how they do this. And it's just something that you might want to think about, because if you intend to be able to stay at work and there is a challenging relationship that you have, I'm going to use language sort of like being the best you is the best way for a relationship to improve. So and it can sometimes be a challenge because you might feel all alone. So you can seek allies. Now, not in a way where you pit your allies against your manager, but the idea is that if you can find somebody else who can provide you with that social support that you feel might be missing from your leader, that you can engage in that in a productive way. And so being very careful about that what you are trying to do is build positivity in the workplace. You can request to have training to come into your workplace. It can be actually an accommodation request to say, I would like to be able to have as part of my accommodation that my leader and the team and perhaps the organization receive training to increase our mental health literacy so that we can all be more effective, so that we can improve the psychological health and safety in terms of our culture in the workplace. So you can begin to speak this language. You can begin to be a champion for the issues. And I fully acknowledge while you are struggling, it can be very difficult to do that. So temper it. Make sure that you maintain the balance about being the advocate, but also in taking care of yourself.
Mm-hmm. All these comments are really related in these questions, so here is the next one. The limits and boundaries for a manager in bringing up mental health issues. And David and I have heard this many times over the years. You know, as a manager, what's appropriate? What are the limits in terms of what I can approach an employee with if I have concerns about their mental health? Would you,
Sure.
Either of you like to address that?
The people get really wound up about this, and yet you don't have to talk about somebody's diagnosis in order to talk about the issues that are presenting themselves in the workplace. So, for example, I wouldn't say, I think you might have a mental health issue if the person it doesn't have that kind of relationship with me. With Donna, I could say, do you think you're unwell again? Because we had that. But I might be able to say, do you know what? You weren't yourself at that meeting. You're usually really positive and you contribute, and today you seem to really be struggling. So I'm talking about what I saw, the behaviors, exactly what I saw. It's performance management, right? It's workplace issues. That's what you're supposed to talk about. You're not supposed to be talking about somebody's health or wellness. You're talking about what's going on. So there's nothing that can't be addressed. Mm-hmm. It's that, and the other thing that I have to say is that if someone feels safe, they'll disclose to you. But if everybody in this room disclosed that they had depression, some of you would be weepy and crying. Some of you would be angry and irritable. Some of you would be withdrawn and not connecting. Some of you would be smiling and joking and doing everything right. If I knew that you all had depression, it doesn't tell me how to react to you, right? Only your behaviors, only what you're giving to me tells me what you need from me. And to ask you. You know, when I do a performance review, I turn the page over and I say, okay, what can make me a better manager for you this year? What do you need from me? Because I don't know.